Hey guys, Dr. Eliza here with Conquer Movement Physical Therapy. We have been seeing a lot of athletes in here, especially rotational athletes, and we've noticed some patterns. So just wanted to give you guys some information about what we've been seeing and how you can do some testing to see if you're limited in any of these areas. So the first thing we've seen is a lot of hip internal rotation limitations. So what that looks like with my foot off the floor is lacking mobility this way. But if you think about that boxer, that golfer, when they're rotating this way, that hip is actually internally rotating. The second thing we're seeing is a lack of thoracic mobility or mid-back. So we're limited going side to side this direction. And the last thing we're seeing a lot of is limited shin or tibial rotation. So again, as that foot is planted, there has to be some mobility there in that shin. So I'm going to show you guys a couple ways to do some self-tests for all of these ranges of motion, and then you'll see if you have any limitations there. Here's your test for testing the hip internal rotation. Grab a block. If you don't have a block at home, grab a roll of paper towels. It doesn't need to be a yoga block. All you're going to do is stick it between your knees and then see how far you can rotate that leg out to the side. As you do that, appreciate the quality of the movement. Do you have any pinching in your hip? Is there any pain in your lower back? What are you feeling there? So do that a couple times, see how one side feels, and then compare it to the other side. See if you notice a big difference side to side. Okay, here's your next test. Let's test your thoracic rotation. Put your arms up like a goalpost, and then from here, just try to rotate as far as you can to one side. Notice that I'm not moving at all through my legs, because I could do this. But let's try to limit any leg motion and compensation there. Again, let's look at that quality and see how it feels side to side. Do you get a cramping in your ribs on one side? Do you get any low back pain? Do you have more stiffness on one side? Just take note of any differences you feel. Last test here. Again, grab that yoga block, grab that roll of paper towels, stick between your knees, and let's look at that tibial or shin internal rotation. So, without moving from the legs, see how far you can rotate that foot in. Couple things to notice here. Make sure that that heel stays flat on the ground. Your foot isn't moving. We're not getting any of this inversion at your foot. So keep everything nice and flat. See that motion side to side. Note any differences side to side and the quality of how that movement feels. Now that you've gone through all of these self-tests, if you found any restrictions side to side, or you just want to become a more well-rounded athlete, more resilient human, keep watching and I'll show you my top 3 favorite videos for mobility.
Half kneeling thoracic rotation drill. I have my foam roller in between the inside of my knee here and the wall, and I'm giving some gentle inward pressure. This is going to keep my hip adductors engaged and prevent my pelvis and lumbar spine from rotating too much so that we can target our upper back. I got my ball here. I'm going to start pressing this guy into the wall, palm down. I'm rotating, swimming by here, looking back. Come back that way, replace this hand with the ball, light pressure in, and then reaching behind. Opening up that mid-back region, looking to improve our upper back mobility. We're working our tibial rotation, both internal and external. If we break down the biomechanics of the knee, we know that at end range extension of the knee, we get this what's called lockout mechanism where some tibial or shin outward rotation has to occur. And then the same can be thought of that end range flexion. So if you're having pinching or difficulty moving into those end ranges, this may be the key component that you're missing. So one way to work on this control and this education of this movement, get your yoga block. We're going to give some inward squeeze here, which is going to keep our hips engaged and locked up so that when we're moving and doing this movement, it's only knee or shin moving. I got my foot on a nice furniture slider or exercise slider, whatever you're using, and then a kettlebell. I'm going to rotate As I maintain the pressure here, nice, slow and controlled, going in and out against resistance.